Hello, my name is Chris, and welcome to this edition of Writing Guide 2. And today we're going to be talking about a radiological technologist. This is also Missy, who will probably be interrupting here and there. Oh, thank you for the kissy. Mwah. So, we're going to go ahead and get started with my mother here, who has been very kind to help me with my first video. She is a X-ray tech, or also known as a radiological technologist, and that'll become important later. And you have been doing this pretty much since I've been alive, correct?
Yes, for 38 years.
In case anyone missed it, I'm 38 years old. I'm going to get started with what does Hollywood get wrong about your job profession? Now, I'm sure you've seen a lot of shows that have featured an X-ray tech. Does Hollywood get it right, or did they just completely miss the mark?
Most of the time they have no idea what a real radiologic technologist does. And it goes beyond that. It starts with the name, because a lot of people think X-ray tech means X-ray technician, which we are not a technician, we're a technologist. We do have formal training, and we have quite a bit of impact on what the doctors use for diagnosing patients. So that's pretty much the start of where Hollywood gets my profession wrong.
Now, is there any show that you can think of that has shown X-ray tech at all?
Usually the medical shows like Code Black, even shows like Breaking Bad, which I started watching because I saw an interview that said that this would be a show that would get the role of the radiologic technologist in a correct light, because they had expert advisors, consultants.
And in what way did Breaking Bad get it wrong?
Well, for the very first thing, the person who played that part was not an actual radiologic technologist on the show. She was an ultrasound tech, which are two different jobs, completely different training. And at this point, you don't even have to be a radiologic technologist to become an ultrasound tech, because the schooling is completely different. It used to be that you had to be an X-ray technologist first and then work your way into ultrasound. But that was the major way Breaking Bad got the profession wrong. Another way was on a certain show, the actress actually said that she could read the x-rays that were going to be taken, and that they didn't need a radiologist to read them, which the radiologist is the actual doctor who reads the x-rays. We are just the people who perform them and position the patients to get the correct images.
Would Breaking Bad be the one that's been the closest in your opinion, or have you seen another show that has gotten anywhere near close?
I think Breaking Bad is probably the most accurate, even though it had a lot of fallacies in it. But there's also shows like right now, Code Black is a pretty good show. However, whenever they call for an x-ray on the show, they always show a radiologic technologist walking in with a portable machine, which is fine. But when they show a patient getting an actual x-ray, they show the patient sitting up and having the tube angled completely down, which wouldn't actually show the body parts being requested on the x-ray. So there's still a lot of inaccuracies. There's always people that hang up the films for the directors, and 95% of the time the actual images are hung up backwards or upside down, or they're not the body part that's being discussed with the patients. They also are, they actually still use a lot of film to put on view boxes, which most of the
top tier hospitals.
Most of the hospitals now use computerized images. We see everything on a computer. We take it on a computer. The doctors, have it on a computer to look at. So we don't have actual films anymore. They're all computerized and stored in I guess you would call it a cloud. That that's an actual X-ray program. And now when patients ask for copies of their images, they don't actually get a film, they get a CD with it burned on them, and they can't see those images at home because you have to have the correct software to actually download them and look at. So that has to be done by a doctor or hospital.
But not everywhere across America uses the display. They still use film. Is that correct?
Usually in doctors' offices, because X-ray equipment is very expensive. So if you go to your, say, orthopedic doctor or a family doctor, most of the times they will have film still. But those are being replaced on a regular basis. So I would say probably in the very near future there won't be actual films anymore anywhere, because that equipment is getting old and worn out, and it's not as
cost effective.
It's not cost effective because you still have to store all of those films, and that takes a lot of storage space. You can read images on computers better than you can the actual films, because you can manipulate the images to make them bigger so you can see more close up, whereas with the images on a film you can only use a magnifying glass, or use a hot light that you can see if the technique is too dark. So the computers have a lot of advantages that regular film doesn't have.
So it's far more productive.
It is. It's more efficient, I think, is the maybe not efficient, but you can see a lot more, and it is better quality.
Would there be any advantages that film have over, say, the computer screen?
Not really. I know when we changed from film to computerized images, we had a lot of questions about whether it would be better or worse, because we could not imagine having a computerized image that was as good as the images that we took on film. But over the years, it's proven quite
effective,
quite a lot better than images are on film. And plus, you have the added advantage that you don't have to have a whole lot of storage space physically, whereas in hospitals we used to have image libraries. Now we don't have those anymore because they're all stored on our programming.
All right, so we've discussed, where Hollywood gets it wrong. So we're going to now direct this to where writers and maybe even directors can understand what it means to be an X-ray tech. So the first question I have for you is, I keep using X-ray tech and radiological technologist. Trust me, she's made sure I understand use that word correctly. Is there a difference in those terms, or are they really interchangeable?
They're interchangeable. If you shorten it to tech, that we always take it to mean technologist, whereas a lot of people, they will say, oh, you're an X-ray technician. Actually, technicians are the people that work on the equipment. They're more like mechanics, and we are the imagers. We are the people who use the machines to get images, to obtain the images that make the diagnosis for the doctors more accurate.
Okay, but radiological versus X-ray, which is the more correct term?
Well, when you say radiological, that's mainly our whole entire department, and X-ray is just the diagnostic imaging part of that. So radiology includes CAT scans, MRI, nuclear medicine, ultrasound, DEXA scanning. So that is a all-encompassing word. Radiology is like the whole all-encompassing word, whereas X-ray is the diagnostic imaging part of the whole department.
So you're part of the radiological department, but you're more specifically an X-ray tech.
Right.
Okay. So can you go into more detail about what it is that you specifically do?
Sure. We initiate a patient by, we get an order from the doctor for a certain body part that needs to be x-rayed. It's either someone who's injured or sick. So we get the order from the doctor, and then we talk with the patient to make sure that the right body part has been ordered. And we try to make the patient as comfortable as we can and explain to them what the exam is going to entail. I work with a lot of kids, so I always tell them we're just taking pictures of their bones, so that comforts them and puts them more at ease than they would be otherwise. Then we position patients for the x-ray, which includes putting their body parts in different positions. Usually we take 3 different images on joints and 2 different images on long bones, and that goes for chest x-rays and abdomen x-rays as well, which don't actually show the bones. You can see the bones on there, but when you're doing a chest x-ray, you're taking a picture basically of the lungs and the heart. Although everything shows up when a physician orders a chest x-ray, they're basically looking to see if there's pneumonia in the lungs, or if there's air in the lungs or around the lungs that shouldn't be there, the size of the heart, things like that. And as for the abdomen, usually whenever you're taking an abdomen x-ray, you're looking to see if people have a full colon or not a full colon, because if you have a full colon, that generally means you're constipated, and that's causing your abdominal pain.
So, in other words, a misconception about x-ray techs is that you're just looking for the bones, but the equipment can see a lot more than that.
Right. The equipment has a sensitivity to show up soft tissue, and also if you don't see the soft tissue, you can still see the bones, and you can tell if there's a sprain or a torn ligament just by the positioning of the bones. So you don't necessarily have to see soft tissue to know that there's a sprain, because you can see if the bones are not aligned the way they normally should be, that the doctors can tell that there's a sprain or a strain of that muscle.
All right, so what would be, I'm sure every day is going to be different, but what is generally your day-to-day like? What is, you just walk into the office, and what do you expect to see? What normally happens on your shift?
Well, I work at an urgent care now, so usually when I go to work, the day shift is usually doing normal routine patients that come in from other doctors' offices. We will see a lot of patients who are sick as opposed to injured, because sick people generally go and see their doctors during normal business hours, and then so we do a lot of chest x-rays, a lot of abdomen x-rays, maybe sinus x-rays to see if your sinuses are full of fluid or not. So that's what I deal with whenever I first come to work. Then we have an orthopedic doctor who sees a lot of orthopedic injuries, so we generally take a lot of bone x-rays as well. Then whenever the urgent care opens, I generally deal with people who have immediate injuries that are acute, that need to be x-rayed before they are treated, so that they can see whether there's any broken bones or not. So that's kind of a different situation because everything is very acute. Everything is not an emergency, but needs to be done as soon as possible. So it's a very fast-paced environment.
One thing that people know about being in hospitals or doctors' offices is that sometimes doctors can be a little full of themselves. And there are a lot of good doctors out there, but certainly that's from the patient's experience. What is your experience in dealing with doctors?
Well, I think a lot of doctors have to get the test results before they know what's going on, and they're not mind readers, so they have a certain protocol that they have to follow whenever someone comes in and says, I have a sore throat. Then they have to do the lab testing that that shows whether they have strep throat or not. They have to do maybe a soft tissue neck to find out whether the person has problems with croup or like swelling of the adenoids and whatever. Doctors mostly have to go by what the test results show and what the patient's telling them. And if a patient only tells them half of the story, then the doctor can only go on what he has knowledge of at the time. A lot of people think that doctors don't always get things right, which they don't, they're human. But all the testing and everything ensures that most of the time they get it pretty close to correct. But I have run across a few doctors who seem to not hear what you're saying to them or understand what you're saying to them. And then whenever we get the patient in the room for the x-ray, the patient will ask us, why am I getting an x-ray done? What is this going to show? And a lot of times we don't know what is in the doctor's mind as to why he ordered a certain x-ray, but they generally give us an overview of why the patient's there. So if, for instance, if they order a chest x-ray and they say cough, it's because probably that patient has had a cough for a week or two, and it might be more than just a cold. So they're looking in their lungs to see. But we don't have all the information that the doctors do, and we don't have the education the doctors do. But they know that we are a professional in our field, so they usually will ask for our input and appreciate our input to get a diagnosis for that patient.
So what kind of input are doctors asking for?
Well, a lot of times they'll ask us if a patient has a fracture that maybe they're not seeing. They'll ask us to look at the images with them so that we can show them what we think we've seen as opposed to what they're looking at. Just a lot of times they do that just as a confirmation of what they've already seen. They want to make sure that they know what they know, and if they don't get a good response from us, or if we tell them we're not sure, then they'll always call the radiologist and make sure that they get an opinion from the doctor as well. But whenever you have a lot of experience in your job, they tend to trust what your word is because they know that you've been around for quite a few years, and even though you don't have the education of a doctor, you have the education of seeing something over and over again for 38 years. So, and the one thing I wanted to bring up is that a lot of people, even older people now, they still think that if you're a woman in the hospital, you're a nurse, and not. There's a lot of people that work in the hospitals that aren't nurses, and all men are not doctors. In fact, there's a lot of nurses that are men, but there's a lot of people like x-ray techs. We're not nurses. We don't go to school for nursing. We don't mind when people call us a nurse, but it's just a misconception that radiologic technologists are nurses.
So have you ever had a patient ask you something that a nurse would perform?
Definitely. That happens a lot. And when that happens, we just say, okay, we'll let the nurse know that this is what you need or that you have these questions.
And how is your interaction with nurses? Is it about the same with doctors?
Yeah, it is. And plus, we have to have the teamwork to know. Like when I go to get a patient, there's a lot of times when the patient hasn't had the medicine that the doctor's ordered yet. So I'll wait for the nurses to give them the medicine before I take them, or if the nurses it's not an imminent medication that they need, then I'll take them first. But we have to have a lot of communication with the nurses, even more so than we do with the doctors, because even though the doctors are the ultimate caregivers, the nurses are the ones who basically follow through with the orders that the doctor gives them, just like I do. So we have to have a whole teamwork thing going on, because our bottom line is always patient care. So whatever's best for the patient. So if they need that medication right away, I'll wait until the nurse brings the medication. If it's just something that they need but they don't need it immediately, say they're throwing up, then they need Zofran to keep from throwing up, but that doesn't interfere with me taking them to the x-ray room to get the x-ray done, so that we can get that to the doctor as soon as possible so he can see the reason for the patient's distress.
Now, you're mentioning that you go to the room and take the patient there. Is that always the case, or are there instances where the patient is brought to you?
Most of the time, since I work in an urgent care and I work by myself, I always go to get the patient, unless I go to get them and they're not ready, say they're needing their medication first or whatever. Occasionally a nurse will say, oh, I'll bring them down to you when they're ready. Or in an extreme case, if someone has a really bad fracture that's open and bleeding, a lot of times the nurse will accompany us down to the room, which is, when I say the room, it's the x-ray room, because where I work we only have an x-ray room. We don't have a portable unit, so we can't, like when people work at the hospital, they'll take a portable unit down to patients who can't be moved and who can't come to the room. But since it's an urgent care, there's nothing there that is an emergency, so anybody that walks into the urgent care can come down to the room for an x-ray.
Now, you at the beginning of all of this, you mentioned using a portable x-ray machine as seen on shows. Mm-hmm. Is that something you ever use?
I don't have one at the urgent care, but when I work in the hospital, I definitely use a portable machine on a regular basis. In the hospital, they have people in intensive care units and cardiac units who can't come down to the department for their x-rays. So first thing in the morning, usually about 4 or 5 o'clock in the morning, we take a portable machine up to the wards and do x-rays on everybody that has had a standing order or an overnight order from the doctor. So the hospital I work at, usually there's about 25 to 30 patients every morning that needs a portable x-ray done.
Now, certainly doctors and nurses, they're more direct caregivers, and they may find themselves in a situation where a decision they make, saves a life, and they can, feel a sense of pride in that. Have you ever been in a situation, or are you often in a situation where you feel that your job has saved a life and you feel proud that you were a part of that?
There are days where I know that that my job has helped the doctor save a life, and whereas I've never actually saved a life on my own, I've been a part of having people code and helping do compressions, because we all have to be CPR certified. But I feel that my job is rewarding every day, because it doesn't always have to be a life-saving situation. Whenever I have someone that comes in with a broken arm and they're treated and they come in crying and in pain and they leave happy and smiling, it's rewarding to see that I've helped take care of that patient. Definitely in the hospital, there's a lot of life and death situations. They have, when they have heart transplants, lung transplants, radiology is always a part of that. So I think not every day is a life or death situation, but every day is a rewarding situation. And every patient that comes in there, you help one way or another. And that's the whole rewarding part of the job is, you don't have to be a hero every day. But when you just do your job and you do it well and you do it correctly, you have a rewarding experience every day with almost every single patient.
And do you get praise from doctors and nurses for doing your job well?
Actually, a lot of times I will have doctors come back and say that, that was a really great x-ray. I couldn't have found this without your x-ray. And they always comment on how efficient I am. A lot of times they're saying, "Oh, is this patient going to have an x-ray?" And I'll say, "It's already done." And they'll say, "Whoa, that was fast." There's always input from the doctors and nurses. Of course, there's always negative things as well. I don't hear the negative things so much, but I think it's because I've had a lot of experience and I know what the doctors and nurses need, and we have a certain flow. I've worked at the same place now for about 10 years, and we have a certain flow, and as long as we all go by that flow, like I said before, the bottom line is patient care, and as long as the patient's being taken care of, we all seem to have a good rapport. And since we work at a small place, everybody has to be a part of the team. So when I need help holding a difficult patient, I have nurses and MAs that will come and help me. Whenever they need help, say someone has been stung by a scorpion and they need someone to help hold the patient down so they don't hurt themselves, I'm available to do that. So we all have a very large sense of camaraderie and teamwork. And even though the doctors and nurses have more education, a lot of them don't have as much experience. So where I work, most of the doctors and nurses don't feel like they're better equipped to handle patients than I am. We just all have our own separate jobs, and all of the jobs are important.
Now, certainly, having worked 38 years, you've done, different hospitals, you've even done traveling.
Mm-hmm.
And probably not at where you currently work, but in places in the past, have you ever received pressure from medical staff, doctors and nurses, to take care of a patient right now that you have other patients that you have to take x-rays of, but they come to you and say, well, we need this done now?
Sure. Yes. Especially when you work at a trauma hospital. Whenever when an ambulance or a helicopter brings in a trauma patient who, say, has been shot in the head or jumped off of a balcony or whatever, those patients need to be seen immediately. The good thing about that is they're in a hospital setting, so there's generally more than one x-ray tech at a time, unless it's the middle of the night. And most places I've worked, I've been the only x-ray tech there. But sure, there's always doctors that will call and say, I need this x-ray immediately. Stat is our word for that. And whenever they order an x-ray stat, that means that all of the normal routine patients have to wait, because that one needs it immediately, because it is generally a life or death situation. So we understand that that's a life or death situation. So when a doctor says now, we're there now. Just like when we go to surgery cases, when you can sit there for hours waiting to do an x-ray, but when they need the x-ray, they need it right this second. Most of the surgeons understand that we need to have time to set up the equipment and everything, so that's why we usually set it up before the surgery starts. So that way when they need the x-ray, they can have it immediately. So basically, it's like patients going into a doctor's office that have to sit there even though they have an appointment, and they have to sit there and wait an hour or two because the doctor is running behind or he's scheduled too many patients. We are kind of in the same boat with that when it comes to surgery, or when it comes to a doctor treating someone like that they just put a central line in or something that needs the x-ray immediately. Our time is not as valuable as the doctor's time because the doctor is there saving a life. So we tend to be the ones to wait until they need us, but then we have to be there immediately when we're needed. So that happens in a hospital setting frequently, but that's just a part of the job. We have to be there when the doctor needs us. If we're not, then the patient suffers the consequences of that. A lot of times in that situation, it is a life or death situation. So we have to be a part of the solution and not a part of the problem. So we have to be there when the doctor needs us immediately.
So let's look at your job specifically. So you walk into an x-ray room. Let's say the patient is there already on the table. So walk us through from positioning the patient to working on the equipment itself. How does that come together?
Okay. Well, it depends on what kind of an x-ray the patient requires. But if, say I'm working at the hospital and the transporter brings the patient into the room, I'll go in and I'll say, "Hi, my name's Jolene. I'm going to take some x-rays on you." Let's say we're doing an ankle x-ray. I'll tell them, "I'm going to take 3 pictures of your ankle. So we're going to put you over here on the table. We'll set it all up, and I'll take the 3 pictures with you laying on the table." And then we will always put a lead shield across their abdomen because it's important to protect the reproductive organs. And no matter what the age of the patient is, we usually put a shield on them. Even if they're past childbearing years or not quite at childbearing years yet, because the reproductive organs are the part of your body that divides and multiplies the fastest, and that's what radiation can affect. So we always cover up the reproductive organs. Then I will tell them, "Okay, you hold right here. I'll put your foot in a certain position and you hold this until I take your picture and tell you can relax." Then I will go over to our equipment. I will set up our machine, which means that we have kilovolt peaks that we use and milliamperes. So the milliamperes is basically the amount of time that it takes us to take the picture, and the kilovolt hours obviously are what generates the electricity to go through the body part. So we set up a technique that would be correct for an ankle, and then I will take the picture. Usually it's a button that we push that makes the rotor go so that it can divide the ions from the electricity. So that's what basically goes through the body is ions. So we go through that, and I come back out to the room and tell them, "Okay, let's take the next picture, position them for the next picture, do that 3 times, and then help the patient get up off the table, because generally if they're having their ankle x-rayed, it's because their ankle hurts. So we generally put them into a wheelchair and take them back to their room. We always ask them if they have any questions that we can answer for them. A lot of times they'll say, "Is it broken?" And we can't tell them because we're not doctors. So we just tell them, "Well, we have to show the doctor the pictures and they'll let you know." A lot of patients get upset with that because they think we know and we're just not telling. Or a lot of patients will assume that if we don't say, then it automatically means it is broken. But we try to word it so they know that we're just the people who take the images. We're not the people who read them. And a lot of people say, "Oh, you're just an x-ray tech," which it's true, we are just an x-ray tech, but that doesn't mean, "Oh, you're just an x-ray tech." That means that our job is to take the images and to make sure that they're readable so that the radiologist can look at them to see what's wrong with the body part. So, that's just like telling a teacher, oh, you're just a teacher. Well, yeah, you're just a teacher, but your job is to teach people, So it doesn't really offend us when they say you're just an x-ray tech, because that is what our job description is. And whereas when we've done the job for years and years like I have, yes, we can tell whether a bone is broken or not, but there's still a lot of diagnoses that we can't tell you. I can tell you, I can tell if someone has pneumonia because you can see what it looks like on lungs, and after you've done that for a few years, you can recognize it. However, it's not our job to give a diagnosis, and I will often tell people, well, if I read the x-ray for you, then what's the doctor going to tell you? So we have to use humor in our job, we have to be polite to people, and we have to inform people. Part of our job is informing people, giving, always having a teaching moment, always being able to tell people, we can't tell you what's going on with you, but the doctor can now tell you what's going on because he has that image.
And certainly you only have one piece of the puzzle, whereas the
right.
doctor has all the pieces of the puzzle.
Right. We don't do a physical exam. We don't have that training to do a physical exam, although we can tell when an ankle is swollen to twice its size. We know that, but it's not our responsibility to give that information to the patient. And there are also times where, especially more inexperienced technologists, can look at a film and say, oh, that's definitely broken, and then it can be read as not broken, especially in children, because children have growth plates that adults don't have. And sometimes, I've had parents take a glance at the computer screen without my permission, because, people will jump to conclusions. They'll see joint spaces on an x-ray and say, oh my goodness, it's broken, it's broken, it's broken, and go back and tell the doctor, oh, I saw the pictures, it's definitely broken, when there's actually nothing wrong with that body part. So, we can't say, yes, it is broken, or no, it's not broken, because that's not our responsibility.
So, we've had this conversation before many times, and I know how ridiculous this question is, so not to sound demeaning, but certainly it's going to be asked by other people. Couldn't your job be replaced by a machine? Couldn't just a machine do everything that you do?
Well, we've often had dreams of having like a booth that you can just walk into, kind of like the airport, where you can just walk in there and have a whole entire body scan. Unfortunately, something like that can miss a lot of things because it's a more generalized thing. And whereas that would be a nice fantasy, I don't think that's anywhere in our near future, because we already have computers that help us do our jobs, but you still have to have the human touch. You have to be able to position the patient in the correct positions they need to be in. You need to be able to talk to that patient and get them to cooperate with you, and so that you can get the correct images. And even if it was like a total body scan, kind of like CAT scan is now, you still have to have the human element there. You have to have someone who knows the techniques to use. You have to have, because your whole entire body is not a one-size-fits-all technique. You have to, you use a certain MA and KVP for a hand as opposed to an abdomen. So I can't imagine they can make a computer or a piece of equipment that could do, that can record all the nuances that we have to go through every day. That's why we have to take 3 or 4 different views on every body part that we take, or 2, depending on the body part. But even at that, there are certain times where a foot x-ray might not show up a fracture for a week or 2, just because the fracture is so minute that you can't see it on the picture until it's a couple of weeks old, because then it starts to separate and heal so then you can see it. Like I had a fracture of my foot and ankle several years ago, and actually I had 3 fractures, 2 in my foot and 1 in my ankle, and none of them showed up until 2 weeks later when I went to see an orthopedist, because it had had time to separate a little bit and to start the healing process. Now, a lot of people think that I've heard people that I've x-rayed after they've had an x-ray a day or 2 before to tell me, oh yeah, they said it wasn't broken, but now we know it is, so the doctor didn't know what he was doing. And that's not always the case. In fact, that's hardly ever the case, because sometimes fractures hide even on regular normal x-rays. And sometimes it takes a few days for it to show up. When that happened to me, all I could think of was, I've told people this for years, and now I actually have the experience myself of going through that. So, but x-rays are a part of a puzzle. It's not the main part of the puzzle. Even for a broken bone, there's so many other things that go through that. Yeah, the x-ray shows a broken bone most of the time, but it still takes the doctor's exam, the patient's cooperation to get the exam, and actually a lot of medication and whatever is involved with the whole treatment of the patient. So honestly, getting back to your question, I don't think that will be replaced by machines very soon.
Now, let's you talk a lot about your experience, so let's delve into that a little bit. How did you become an x-ray tech? What training did you specifically have?
Well, I guess you could say I kind of took a shortcut because I joined the Air Force, and during basic training they did a lot of testing to see what you had an aptitude for. And at the end of my basic training, I got a little slip of paper that said I would be a radiologic technologist. And my friend that was standing with me, she said, "What is that?" And I said, "I have no idea. Maybe it has something to do with radios." So I went to my next base and got started my training. We had a phase 1 training, a phase 2 training, and then a phase 3 training. So even though right now radiologic technologist program at a college or junior college is a 2-year program, my training was about 2.5 years. A lot of it was on the job training, but we did have a couple of hours of classes every day until our phase 3 training, which was mainly on the job training, but still bookwork on our own. And then we had to take the test that everybody that's a radiologic technologist takes. It's a countrywide registration test to be certified in radiologic technology. So I had to do that before I got out of the military. Right now they're trying to change the program from a 2-year program to a 4-year program, so that right now we are not considered professionals as radiologic technologists, but if we get a 4-year program, that will change. But anyone who knows radiologic technologists knows that we are as professional as nurses and doctors. We just don't have the same amount of training that they do.
So, over the years, I imagine that not many people come from the military to become radiologists. So they go to colleges and tech schools and whatnot. What is your opinion of someone who goes through that? Do they receive adequate training in that, or is it more just book work and they get their actual education when they come for the first day of work?
Well, most of the colleges and junior colleges, or even just an x-ray program like the local ones here, they do have mainly book work, but at the end of their training, they also have clinicals where they go to certain hospitals that are willing to teach, and they have a lot of physical training with the patients, and they have to be compliant with all of the regulations and learn all of the positioning and everything before they graduate from that program. So I think that the training is very up to date, but like me, I started 38 years ago when there was nothing but films and processing and old-fashioned things. So we've had to learn our training with computers and current practices. We have to learn basically on the job. Whereas I know a lot of things that I was trained to do that no longer matter. I think a lot of the newer students don't have the background to understand how our profession has evolved to where it is now. So I think there's good and bad. It's like every other generation. I'm sure that mechanics now know how to work on newer cars, whereas I remember when I was a teenager, my father was a mechanic, and he would work on older cars, but whenever I got a car that had a computer in it, he said, I'm not working on that because I don't know anything about computers. So it's like everything else. A mechanic from 80 years ago wouldn't know how to work on everything involving cars now, but the people now don't really understand how, say, a hand crank would work or something like that. So it's always just the evolving of your job. But I think I have the best of both worlds because I had to learn the reasoning behind our profession. And a lot of people now don't understand that, but they understand computers and are more equipped to handle the newer things. Whereas I still know my job, I just have trouble with the computers sometimes.
Now, didn't you tell me that you used to have to hold the patients up to the sun to see?
Yes, that's what I said. I've been an x-ray tech ever since before there was electricity. So in those days, we just had to hold somebody up to the sun to see through them. So yeah.
So then your profession is one of constant learning.
Right.
So I see you with these x-ray magazines.
Mm-hmm.
So is that where you get the majority of your education then?
Most of it, but we also have seminars that we can attend. We also have we have our radiologists that go to their learning sites and come back and give us in services on what they want to see on x-rays and how to obtain those x-rays. So yeah, we are always learning. We are always having to deal with new things, and we have to mutate.
Well, with all that radiation, I can see that. Yeah. So, now one thing that we had talked about prior to this is when you're having to hold down a patient, and because you deal with children a lot, you have interactions with the parents that, for the most part, they're happy to help in any way they can, but certainly you have not so great experience with that. Can you go into that a little more?
We do have people that tell us that we're torturing their children by making them hold still. However, taking an x-ray is a lot like taking a regular picture. If you, of course, maybe the phone cameras nowadays aren't as bad, but I can remember when you actually used a camera to take pictures with, and somebody would be running across the way and you take a picture and all you see is a blur. So it's important to have someone hold still because it blurs on the x-rays just like it would on a regular picture. And that's why we have people hold their breaths. That's why we have people hold down the babies, especially, and the toddlers. And a lot of people say that's torturing them. However, in my view, it's not torturing them. We're holding them so that we can get an accurate image of them so the doctor can treat the patient, which is why we're there in the first place, is to make sure children get better. And we do that any way we can. And we don't harm the patients. But, a lot of babies, they don't like being held down. So they cry. That's normal. And whereas we're not immune to their crying, we have to do our job in spite of their crying. So, there's a big difference between being sympathetic with the patient and their parents, because we do deal with the parents on a regular basis. And a lot of parents help. A lot of parents say they don't want to help, and a lot of parents try to help but don't understand that they actually have to hold the child still. But in my view, the firmer you hold a patient and get the picture the first time, the less radiation a patient's getting, the better the picture is, the more likely a doctor is to make a correct diagnosis and to treat the child with what's needed. So yeah, we don't enjoy thinking that we're torturing patients. I personally don't think it's torture. So, but almost every patient that comes in that the patient has to lay down on the table, the parents will say, well, they're going to cry. And we say, yes, they are. That's normal. If a patient doesn't cry, then there's probably something terribly wrong with the patient. So that's just a normal part of the job, and it's not something that you enjoy, but you know that that's a part of making that patient better. So
in a lot of ways, it's like giving a shot.
Exactly.
Patients going to cry. They're going to have issue with the needle. Some people are afraid of needles, but it's necessary to inject them as part of their treatment.
Exactly.
Is it easier to work with adult patients or children, in your opinion?
I don't think that the word easy ever enters my mind when it comes to the job. Obviously, adults are a lot easier to communicate with, and most of them can understand better than children can. However, whenever you do x-ray babies and little kids, it's easier to get them to hold still when you can pick them up and hold on to them yourself, which I can't do because I'm the only x-ray tech and I actually have to be the one obtaining the image. But I say they both have their good parts and bad parts. And sometimes it's easier to take a picture of a teenager than it is a baby, but sometimes it's easier to take a picture of the baby, because even though babies fight with you, you can outmaneuver them sometimes. Whereas a teenager, if they don't want to do something, they're not going to do something.
So really it's just apples and oranges?
Yes.
Now, we speak a lot about radiation, and you talked about using a lead apron and all of that. What danger is that radiation to the patient, and also how dangerous is it for you?
Well, for the patient, we use a very, very low dose of radiation because we deal mainly with children. And the physicists understand that any amount of radiation is not a good amount of radiation. However, we deal with radiation on a regular basis in normal life. When we go out in the sunshine, there's radiation from the sun. When you stand next to a wall, there's radiation emitting from a wall. We have radiation in anything that has a mass has radiation. But you don't walk by a wall and say, oh, I'm getting irradiated. You just think there's a wall there. So we do shield everyone just simply because the reproductive organs are very susceptible to radiation. So is bone marrow. So are glands like the thyroid, and we understand that. However, the amount of radiation it takes to x-ray a baby's chest is probably about a 10 to 15 minute stint in the sun. So it's not going to harm you, but in our profession we've been taught that no amount of radiation is good, but there is an amount of radiation that's acceptable. It's a trade-off for finding out what's wrong with you, as opposed to putting a little radiation into your body, which most of the radiation goes through your body, so there's very little residual in your body, and that's basically absorbed like any other radiation. There's no amount of radiation that's good for you, but there is a lot of allowable radiation that is acceptable. And we have a term that's called ALARA that every radiologic technologist knows. And it is, ALARA means as low as reasonably allowed, which means that we have to get the picture as best we can with using the least amount of radiation that we can. So for people that are worried about radiation, an x-ray is not a horrible thing to have, as long as it's done by a professional. You don't want somebody in there that doesn't know what they're doing, and that's another thing that we didn't really cover, is that we have to be licensed and we have to be certified. In most states we have to have a certification, because not just anybody can run an x-ray machine, because of the radiation that it emits. So,
but do you are you exposed to that radiation? I mean, I'm sure you get a little bit every time you do it, but I mean, doesn't that build up since you're constantly using that machine? Or
sure, but we have a little dosimeter that we wear, which measures the amount of radiation we get. It used to be like on a monthly basis. I think now we have them for 3 months at a time. But we have a company that measures the amount of radiation we get. Plus, we have a little room that we go into when we take the x-rays, so that we are at least 6 feet away from the radiation, which is what is a norm. You have to be at least 6 feet away from the radiation if you're not the actual patient or someone holding the patient. I do on occasion hold patients during the daytime when I have another x-ray tech there, and that's where the dosimeter comes into play. We have to wear that all the time that we're working, so that they can measure the amount of radiation we receive. So that's monitored closely all the time. But when we work alone, since we're the ones using the machines, we're usually far enough away. Even when what we call scatter, which is when the radiation hits the target and then bounces back up, it can scatter in the room. But usually we're far enough away that even the scatter doesn't reach us. But we do still have a lot of radiation-related deaths in our field. A lot of people die early from cancer or cancer-related things in my profession, but I think that that's getting better with the years and the reduction in radiation as they learn more ways to reduce the amount of radiation that we give to the patient, and that in turn limits our radiation exposure as well.
Now, there are other safety measures taken with x-rays, such as lead walls.
The rooms are lined with lead. Our doors are lined with lead. That's more to protect the outside passerbys from getting any kind of radiation. We obviously have our lead aprons that when we do fluoroscopy studies, the radiologist and we and the patient's parents wear lead aprons. In our particular establishment, we put a lead apron over the table and lay the child on top of it because the radiation comes up from the table the other way. So we protect patients as much as possible from the radiation. Radiation protection is like one of our major rules. So we have to do everything we can to protect everyone from unnecessary radiation. And that includes questioning doctors sometimes when they order x-rays that might not go along with the patient's complaints. So we always have to be aware that we have to protect the patients from as much unnecessary radiation as possible.
Now, not that anyone would ever do this unless they're very sadistic, but can the machine be used to give someone a lot of radiation? Or are there too many protocols in place to prevent that?
Yeah, we have too many limits. Our equipment will only go so far to radiation exposure. I had a little boy a few months ago when I went to get him for his x-ray. I think he was about 5 or 6, and his father had told him that maybe I could turn him into the Incredible Hulk when we were in the room. And I told him, I'm sorry, but I'm fresh out of gamma radiation, so that's not possible. But no, we can't use a whole lot of technique because our equipment is only suited to go up a certain amount, so that we couldn't accidentally poison someone with radiation.
And for anyone who's curious, this is where my nerdum started. I mean, she knows enough about the Incredible Hulk to get it right. So earlier we talked about, you mentioned about ultrasound, and that used to be a way that you have to be an x-ray tech first to be an ultrasound. Is there any other profession that comes from being an x-ray tech first?
Most of them do. CAT scan, most of the CAT scan technologists started out as x-ray technologists. MRI, the same thing. You don't just wake up one day and say, I'm going to be an MRI tech. You have to be a radiologic technologist first. Nuclear medicine used to go the way of x-rays, but now they have their own programs, so you don't actually have to be an x-ray tech to be a nuclear medicine technologist anymore. I think that's about it. That's like the main focus of hospitals now. I know PET scans are the same way. You have to be pretty much a CT tech before you can do PET scans. So we all have a succession, and most radiologic technologists don't stay in the profession for very long before they upgrade to a different modality. So it's very rare to see a radiologic technologist that has been one for 38 years.
And out of curiosity, why haven't you made the transition to those other fields? Because I imagine they pay more.
They all pay more, and some of them a lot more. But I just like the
interaction.
The interaction. I just like the atmosphere of being an X-ray tech. I like the patient connection. I like the way that like most x-ray, you get an instant satisfaction with the patient. You take the picture, you see the picture, you know that person is going to be treated right now, and it's almost an immediate response. Whereas with things like CT and MRI, most of it is doctor driven, so you have to have either a radiologist present when you're doing most of the exams, or you put a patient in a different room and you don't really interact with them as much as you do with regular x-rays. So I don't know, I just have always enjoyed my job and just have never really thought about doing anything else, even though it pays more and it's a lot less wearing on your body. It's not as physical most of the time, but I just enjoy doing it, and I think that I've done it long enough that I've pretty much got the hang of it now, so it's something that I enjoy doing.
And it's also something that you could easily get a job anywhere, or?
You can usually get a job pretty much wherever. However,
I mean you yourself.
Well, I'm getting old enough that they pretty much will hire younger, newer techs because they don't have to pay them as much, because they don't have a lot of experience. So a lot of people will hire students right out of school, and so we've kind of like ridden the wave of people wanting experience to now they want younger people that they can mold into their own way of doing things. But I've never had problems finding a job. I've always had a job, and even traveling. I traveled for 4 years, and just as a general tech. Nowadays, most of the travelers, they want to have at least CT experience, but I've never had trouble finding a job. So I think now, though, my age is starting to work against me more than for me. But
was there a component now in working so many years that you're kind of an instructor to new people who come in?
If I were working at the hospital, I would probably deal with students a lot more. But where I work, it's basically me. Every once in a while, I will have someone that's starting out at the hospital, or a new student that they will send out just for a day or two to see what the dynamics of working in an urgent care is about. So I still do a little bit of teaching. I used to do a lot more, but my career's winding down now, so hopefully this will be the last job I have.
So to anyone who's still watching, they've certainly learned a lot about what it is that you do, what the profession is about, and hopefully they can display it in a more accurate way. Do you want outside, baby? The little diva has to interrupt us. What would you like to see people try to capture when they feature a character who's an X-ray tech, whether it's in written format, movie, TV show? What do you think they need to focus on more to make it more of an accurate portrayal?
Well, I think that if X-ray techs weren't just a walk-in, walk-out kind of a thing, if they were portrayed as a real person, maybe, instead of just
a lackey,
kind of like a piece of the equipment that's just there for show and then sent back out of the room. And I don't know, I think a lot of people say that they have medical people on the show to make sure that the details are correct, but I think unless they actually have a radiologic technologist, then the details will never really be that correct, because you can have doctors that are on there. Doctors really don't know what our job entails a lot of times. Doctors just give us an order and expect us to get the images whatever it takes, and they don't really understand the dynamics of what it takes sometimes. So I think it'd be kind of cool to have a show about X-ray techs, kind of like Scrubs, but for X-ray techs. That'd be kind of cool, just to see what people do during the day whenever they're taking X-rays in a hospital all day long. The silly things that they see, the funny things that go on, the kind of patients that you have to deal with. I think that'd make a great show.
Okay. And is there anything you wanted to mention that we haven't talked about today?
I just think that a lot of people have a misconception of what radiological techs do. I think they just think that they just walk in, take a picture, and that's all they do. Either that, or they think we're nurses or doctors. I've even had a couple of people call me a doctor, and we're not actual doctors. So even my own family, a lot of people call me a radiologist, and I'm not a radiologist. Radiologist is a doctor, and he goes to school a long time to get that title. We went to school for only a couple years, but that was important training. But we're still not doctors. So.
All right, well, thank you so much for taking this time to talk about this.
You're welcome.
I hope that anyone who's watched this, they have learned a lot. I know that this wasn't a live stream like I hope to do with other people, but if you leave a comment down below, if you have any questions that we didn't cover, I will definitely ask my mother. I guess you can't see me right now. Hi. You say hi to Missy again. We'll make you a star. Well, thank you.
You want to come see Mom?
But if you have any questions for my mother about this profession that we didn't cover, or you want more clarification on, just post it down below and I will make sure that my mother gets it and try to get it back to you as quickly as I can. Thank you so much.
Say bye-bye.